Ma'am, I'm afraid I have some rather unfortunate news for you.
What is it, doctor?
You have a bacterial infection.
Psh, that's not so bad. Bacterial infections are treatable with antibiotics.
I'm afraid this bacterial infection is a little different. It appears as though you've contracted a superbug.
A superbug? What's that?
A superbug is a bacterial infection that can't be treated by some current antibiotics. Over time, microbes evolve. Their evolution towards a superbug involves the ability to gain traits that allow resistance to medications, like antibiotics, that had been used to treat them in the past. This evolutionary adaptation is called antimicrobial resistance.
There are a couple key roles of evolutionary biology that superbugs play, and with these key roles being presented, we can figure out preventative measures of superbugs. The key area of evolutionary biology that superbugs undergo would be natural selection.
Natural selection enables a mesh for both resistant and non-resistant strains of bacteria. Bacteria with non-resistant strains have lower fitness and therefore a decreased chance of survival once the antibacterial are applied. The remaining bacterium will have developed antimicrobial resistance, making it difficult for the antibiotics to do their job. The two are always participating in an evolutionary arms race for genetic fitness.
The most common current method of evolution for most organisms is facilitated by randomly occurring genetic mutations that increase an organism's liability to survive by means of natural selection. The newly transformed mutant genes are then spread to the kin and out into the population's gene pool. Biologists have observed as many as 35 random mutations in the viral bacteria of patients being treated with medicinal microbes over the course of several months. This is referred to as evolution with vertical transmission.
Vertical transmission is often complemented by another method of evolution known as horizontal transfer. Bacteria have a unique method of conjuring up genetic mutation through the passing of plasmids between one another. Each time DNA is transferred in the form of plasmids, the bacteria is able to incorporate the sender's DNA into their own genome, meaning that the bacteria isn't reliant on random mutations, but can pick up and pass on positive evolutionary traits from other species. Biologists have observed viral bacteria doing just this in order to defend against the use of antibiotics in modern medicine.
A practical application of this information is that it is a doctor's responsibility to try not to prescribe antibiotics lightly. As a patient, when you're prescribed antibiotics, you should never share them and always take them until the prescription is entirely completed, even if you begin to feel better. This ensures that the entirety of the harmful bacteria are destroyed.